Hey everyone, welcome back to PA Coach Autumn. Today we're diving into the fascinating realm of healthcare as we compare nurse practitioner, NPs for short, and physician assistants or PAs. I'm your host Autumn, and I am a full-time pulmonology PA, and I have over 5 years of PA experience between pulmonology and primary care. If you're considering either of these paths or just curious about the differences in PA versus NP, you're in the right place. Before we jump in, make sure to hit that subscribe button for more content. Let's get started. Today I'm going to be breaking down the PA and NP healthcare career path into a few segments. The topics I'm covering in this video are education and school requirements, specialty options, autonomy within the field, average salary expectations in both fields, and finally job satisfaction and flexibility within either career. This video is going to go over an in-depth review of what route you should choose, or at least really give you an idea of what the differences are between NP and PA. Okay, first off, let's talk average path in schooling. Let's talk about that journey. We're going to review the typical undergraduate requirements for a PA versus an NP. Both nurse practitioners and physician's assistants require a bachelor's degree. The big difference is that PAs will typically have an undergraduate degree in anatomy, biology, or similar STEM-related fields. They don't have to, but usually they do. In order to get into PA school, you will need to complete a long list of prerequisite classes, and having a bachelor's in science will usually accomplish this. Again, you don't have to have this degree. You can always go back for those prereq courses, but you have to do those prereq courses. Nurse practitioners, on the other hand, will have a BSN in nursing. They can have a degree in another field, but in order to actually get into NP school, they really need to have their BSN first. For those applying to PA school, most programs will require 1,000 to 2,000 hours of clinical hands-on experience. This is typically completed in the form of being a CNA, a phlebotomist, med tech, EMT, those types of medical fields. It can be completed with RN, it's not always. You will also need the 50 to 100 hours of PA shadowing hours, which has to be completed before you send off your CASPA for application to those PA programs. Now for NP schools, a majority of the programs will have required some time spent practicing as an RN. These schools will typically recommend anywhere from 2 to 5 years practicing as an RN before they apply. However, in recent years, a lot of NP schools have been started online. There is a growing concern about this new NP diploma mill in healthcare settings. Some of these newer programs that are online are no longer requiring any RN experience before application. This means no time spent shadowing, no time having face-to-face clinical experience before joining that program. The goal with some of these online programs in recent years has been to churn out NPs at an accelerated rate. It also means that some of the new graduate NPs entering the healthcare field will have spent less than 600 hours of direct face-to-face care before graduating and actually entering the healthcare workforce. PA online programs are also starting to make their way into mainstream. However, the PA program accreditation is a lot more regulated. And so those online programs I would be very wary of because one, they're not going to be as selective about the applicants. Sometimes their, acceptance rates are very high, and then the actual program itself is not great at churning out actually good APPs, which gives all APPs a really bad name. Comparing NP and PA school, let's look at the facts. The average program length of an NP program is about 15 to 24 months. The PA programs on average last about 27 months. PA students on average will have 2,000 hours of clinical contact during training, while NP students will only average about 720 clinical hours during training in their program. The PA school model follows more closely with the medical model, while NP programs are going to follow the nursing model more closely. PA school will focus on a variety of specialties with rotations in family medicine, pediatrics, internal medicine, surgery, emergency medicine, and a few specialties thrown in. They have a full year dedicated to just clinical hands-on experience. NP schools typically focus on either pediatrics, psychiatry, or family medicine, and the clinical rotations are spaced out throughout the program with less time required overall. PAs are required to have at least 1,600 hours of supervised clinical hands-on training, while NPs only need 500 hours of supervised clinical practice that they set up themselves in most cases to graduate. Finally, After graduation, the big difference is PAs are going to go on to take the PANCE and NPs will go on to take the ANCC or the AANP to get their certificate of graduation and go on to practice. So this is the main differences between education and kind of the education path for PAs and NPs. Explore the different specialties between NPs and PAs. Both of the APPs can specialize in various areas like family medicine, pediatrics, or surgery. However, the specific specialties may differ. NPs often have a specialized track within that nurse practitioner program, such as psychiatric mental health, neonatology, or family medicine. PAs, on the other hand, generally have a broader medical model approach during their education and can later specialize in various medical fields. For example, the top 3 specialties for practicing NPs are neonatology, psychiatry, and family medicine. For PAs, the top 3 are surgical subspecialties, family medicine, and emergency medicine. As healthcare has evolved and the demand has increased, the NP and PA role has also really expanded. So both professions are really starting to step outside of those original designated roles, and they're starting to overlap more than ever. The typical route that I see is that nurse practitioners or PAs are graduating and starting off their careers in internal medicine family practice, getting a lot of experience under their belt, and then kind of transitioning into those subspecialty roles once they have a very, secure comfort with practicing medicine and treating multiple disease conditions. In summary, NPs may start off initially in psychiatry, neonatology, family medicine, but they can transition into subspecialties. PAs, more often than not, will start off in subspecialties under surgery, emergency medicine, or internal medicine, but they'll also transition into like pulmonology, cardiology, nephrology, all of these other fields. So the NP-PA role has definitely expanded, that there's a lot more overlap than there were maybe 10 years ago, which is great because we're going to need it with all of the aging population. Let's talk independence and autonomy. There's a nuanced difference. Nurse practitioners often have more autonomy, especially in states with full practice authority. They can diagnose, treat, prescribe, medications independently without that supervising physician. Physician assistants, on the other hand, while very highly autonomous, usually practice under some level of physician oversight or supervision. The PA field is moving towards more independent practice, and the supervision has become less, not regulated, but less strict in the last few years. Now it's more of the occasional chart review, case review, or signing off on documents. In my own career, I have managed and treated my own patients on my own panel, but I've always had a supervising physician or doctor to collaborate with on really difficult cases. Personally, I have always valued this relationship, and it really helped me grow early on in my career as a new grad. Take into account the degree of supervision can vary based on state regulations and the specific healthcare settings, and even federal versus state regulations. So for me, working for the VA, there's a little bit different oversight than there is if I were to work locally. Overall, though, as of 2023 and going into 2024, NPs have more autonomy in medicine than PAs. They have a better lobbying body. They have the nursing union. They've done a really great job of advocating for independent practice. PAs are kind of on the fence because we've always kind of valued that physician, PA supervision, as well as collaboration, but we are moving towards more independent practice as, hopefully going into the next few years. Let's talk average salary for both fields. Salaries for both NPs and PAs can be competitive. However, on average, physician assistants might have a slight edge. Factors like location, experience, and specialty obviously play a significant role in determining the salaries for both these fields. It's always essential to research the specific field and region you're interested in. According to the U.S. Bureau of Labor Statistics, PAs made an average of $125,750 annually, while NPs came in with an annual wage of $121,610. This is just the average, with the highest 10% each specialty being paid significantly more. On average, though, expect most APPs to be making a range of $105,000 to $135,000 a year, depending on the specialty, depending on the experience, and depending on the clinical setting. Every state's going to be different, every practice is going to be different, but realistically, NPs and PAs, share a very similar salary range. Okay, finally, let's talk about job satisfaction. Both professions report very high levels of job satisfaction, but the nature of the work environment can vary from job to job. Nurse practitioners and physician assistants may find themselves in hospitals, primary care, or even surgical environments. The satisfaction levels are often influenced by the individual's preference and the dynamics of the workplace. If you don't like your chosen specialty, if you don't like your boss, you don't like your coworkers, or even if you're unhappy with your hours, you're not going to like your job. The great thing, though, is that if you don't like where you're at, you can switch specialties, you can switch clinics, and you can find somewhere where you really fit in, and you're going to be a lot happier. According to the U.S. News, nurse practitioners ranked number 1 for best healthcare jobs, with physician assistants coming in right behind them at number 2. The job growth for NPs do outrank PAs with a significantly higher expected job growth in the next few years. This is likely due to the level of autonomy that NPs experience over the PAs, as well as the rapid growth in nurse practitioner programs that we were talking about earlier. There is also a growing demand for APPs in general, so regardless of PA versus NP, there are going to be jobs out there. Either way, PA and NP were both ranked in the top 5 for U.S. healthcare jobs, in the last few years. It's a great job, and nurse practitioners and physician assistants are overall very satisfied with their career trajectory, which is great news. So if you decide to go either way, you're not going to mess up. Okay, there you have it, the breakdown of nurse practitioners and physician assistants. These are both dynamic and rewarding professions, each with its own unique aspects. NPs and PAs are both vital to the healthcare field, and with our rapidly aging population, the job outlook is fantastic. My only recommendation is that either route you decide to take, ensure that you are going to an accredited program that mandates direct patient care hours. All new providers should have at least 1,000 to 2,000 hours of hands-on clinical experience before they're actually ready to start practicing medicine. Even on the job, as a new graduate, NP and PA, having that physician collaboration, whether you're, an NP in surgery, PA in internal medicine, it's important. Make sure to form those vital relationships and ask for help when you need it. Always feel comfortable asking for help, especially as a new grad. I ask for help all the time, and I'm 6 years into my career. If you found this video informative, give it a thumbs up and let me know what your thoughts are in the comments. Don't forget to subscribe for more insights into the world of healthcare and specifically physician assistants. Thanks for joining me today, and we'll see you in the next video. Take care, everybody.